Pterygium. Introduction. Pterygium is a benign, triangular growth of conjunctival tissue that extends onto the cornea, typically on the nasal side of the eye. Often referred to as Sypha's eye, it is associated with prolonged exposure to ultraviolet, UV, light, wind, and dust. While usually non-cancerous, pterygium can cause irritation, redness, and, in advanced cases, vision impairment if it encroaches on the visual axis. This condition is prevalent in tropical and sunny regions and can recur after surgical removal if risk factors persist. Definitions. Pterygium is a fleshy growth of the conjunctiva that extends over the cornea, often linked to chronic UV exposure and environmental irritants. A degenerative condition of the conjunctiva characterized by fibrovascular tissue invasion onto the cornea, influenced by environmental and climatic factors. Risk factors. Environmental factors. Prolonged UV light exposure, sunlight. Chronic exposure to wind, dust, or sand. Dry, arid climates. Lifestyle factors. Outdoor occupations, example farming, fishing. Lack of protective eyewear, sunglasses or hats. Smoking, potential irritant. Biological factors. Age, more common in adults over 30. Male gender, slightly higher incidence. Family history of pterygium. Ocular surface inflammation or injury. Etiology. Pterygium is classified based on its underlying causes. UV-induced pterygium, chronic UV radiation damages conjunctival tissue, triggering abnormal growth. Environmental pterygium, irritants like dust and wind contribute to conjunctival degeneration and fibrovascular proliferation. Inflammatory pterygium, pre-existing ocular inflammation, example conjunctivitis, may predispose individuals to tissue overgrowth. Types. Primary pterygium, initial growth without prior surgical intervention, often small and asymptomatic. Recurrent pterygium, regrowth after surgical removal, typically more aggressive and fibrotic. Progressive pterygium, actively growing, with increased vascularity and potential to affect vision. Atrophic pterygium, stable, less vascular, and less likely to progress. Pathophysiology. Environmental exposure. Chronic UV light, dust, or wind irritates the conjunctiva. Down arrow. Conjunctival degeneration. Elastotic degeneration of collagen fibers in the conjunctiva. Down arrow. Fibrovascular proliferation. Abnormal growth of blood vessels and fibrous tissue. Down arrow. Invasion of corneal surface. Triangular tissue extends onto the cornea, disrupting the tear film. Down arrow. Inflammation and irritation. Leading to redness, foreign body sensation, and potential astigmatism. Down arrow. Vision impairment. If growth covers the visual axis or induces significant corneal distortion. Clinical manifestations. Triangular, fleshy growth on the conjunctiva, usually nasal. Redness and inflammation of the affected eye. Foreign body sensation or grittiness. Itching or burning sensation. Tearing or dry eyes. Blurred vision or astigmatism, if cornea is involved. Cosmetic concern, visible growth. Sensitivity to light, in severe cases. Reduced visual acuity, if central cornea is obstructed. Diagnostic evaluation. History taking. Duration and progression of symptoms. Exposure to environmental risk factors, sun, wind, dust. Previous ocular surgeries or trauma. Physical examination. Slit lamp examination to assess size, location, and vascularity of pterygium. Corneal topography to evaluate astigmatism or distortion. Visual acuity testing to determine vision impact. Laboratory and imaging tests. Biopsy, rare, only if malignancy is suspected. Ocular surface staining, example fluorescein, to check corneal involvement. Medical management. Pharmacological management. Artificial tears, to relieve dryness and irritation. Topical corticosteroids, short-term use to reduce inflammation, example prednisolone. Nonsteroidal anti-inflammatory drops, NSAIDs, to alleviate discomfort. Lubricating ointments, for nighttime relief of symptoms. Surgical management. Pterygium excision, removal of the growth, often with conjunctival autograft to reduce recurrence. Amniotic membrane transplantation, alternative to autografts in complex cases. Adjunctive mitomycin C, intraoperative application to prevent regrowth. Dietary management. Antioxidants, vitamins A, C, E, to support ocular tissue health, example carrots, berries. Hydration, to maintain tear film stability. Anti-inflammatory foods, example fatty fish, nuts, to reduce systemic inflammation. Nursing management. Risk for ocular irritation related to environmental exposure and pterygium growth. Interventions. Educate the patient on wearing UV protective sunglasses and hats outdoors. Advise the use of preservative-free artificial tears to soothe irritation. Teach proper eye hygiene to minimize dust and debris accumulation. Administer prescribed anti-inflammatory drops as directed. Recommend avoiding rubbing the eyes to prevent worsening inflammation. Risk for vision impairment related to corneal encroachment. Interventions. Monitor visual acuity changes and report significant declines to the ophthalmologist. Educate on the importance of follow-up visits to assess pterygium progression. Encourage early surgical consultation if vision is threatened. Teach the patient to recognize symptoms like blurring or double vision. Provide guidance on avoiding prolonged sun exposure to slow growth. Impaired comfort related to foreign body sensation and redness. Interventions. Apply prescribed lubricating drops or ointments to reduce discomfort. Suggest cool compresses to alleviate burning or itching. Educate on avoiding environmental triggers, example wind, smoke. Encourage hydration and rest to support eye recovery. Offer relaxation techniques to manage irritation-related stress. Risk for recurrence related to surgical intervention or persistent risk factors. Interventions. Educate on post-surgical care, including wound hygiene and medication adherence. Advise against UV exposure post-surgery to prevent regrowth. Monitor for signs of recurrence, example new redness or growth. Recommend regular ophthalmology checkups post-excision. Teach the patient to report early symptoms of regrowth promptly. Disturbed body image related to visible conjunctival growth. Interventions. Provide reassurance about the benign nature of pterygium and treatment options. Discuss cosmetic outcomes of surgery if appearance is a concern. Offer emotional support for self-consciousness about eye appearance. Suggest counseling if the patient expresses significant distress. Educate on preventive measures to boost confidence in managing the condition. Prevention. UV protection, wear wraparound sunglasses with UV/UVB blocking. Environmental shielding, use hats or visors in windy, dusty conditions. Eye hygiene, rinse eyes with clean water after outdoor exposure. Regular monitoring, schedule eye exams in high-risk individuals. Healthy diet, incorporate antioxidants and omega-3s for ocular health. Avoid smoking, reduce ocular irritation from smoke exposure. Complications. Corneal astigmatism or scarring. Chronic ocular surface inflammation. Vision loss, if central cornea is involved. Recurrence after surgery. Conjunctival irritation or infection. Cosmetic deformity of the eye. Conclusion. Pterygium is a preventable and manageable ocular condition strongly linked to environmental factors like UV exposure. Though typically benign, its potential to impair vision and recur after treatment underscores the need for early intervention and consistent prevention strategies. Through a combination of protective measures, medical management, and surgical options, individuals can mitigate its impact and maintain ocular health. Awareness and proactive care are key to reducing its prevalence, especially in at-risk populations.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.